So a conduction system pacemaker is a pacemaker where we position the lead in a very specific place, which is the heart's natural conduction system. So pacemakers we use to treat as a treatment for people when you develop a problem with the heart's natural ability to conduct so there's problems with your heart's conduction system. And with a conduction system pacemaker, what we do is we position the lead. Well, let's do that one again, actually. Sorry.
No problem at all. So one moment then. Speciality video. Question number 1. What is a conduction system pacemaker?
So a conduction system pacemaker is a pacemaker where we position one of the pacemaker leads directly on your heart's natural conduction system. So when the pacemaker needs to deliver a stimulus to activate the heart, it stimulates the heart's natural conduction system, which is a very efficient system and means that you get a very coordinated contraction of the heart. So with a traditional pacemaker, the lead is positioned on the heart's muscle. And this is very good at stopping and preventing the heart from beating too slowly. But then when we stimulate the heart muscle, the activation of the heart is not the same as what happens during activation through the healthy conduction system. The activation is slower and less coordinated. And so in some people, this can lead to worsening of or impairment of the heart function. So the aim of using a conduction system pacemaker is to prevent the deterioration in heart function that we see sometimes with more traditional pacing. We're currently still we're running studies to precisely identify which people benefit the most from conduction system pacemakers. If you have an indication for pacing the heart because your heart goes too slowly and you're likely to need to pace the bottom chamber of the heart a lot, then a conduction system pacemaker is very likely to be helpful. So the main benefit of conduction system pacemakers is that we're able to restore or maintain the normal, very efficient activation of the heart, and by doing so, we hope to avoid the heart function getting worse, or in some indications, we can actually improve heart function, so return it back to normal if you've got pre-existing problems with heart function. In terms of risks, there are risks with any pacemaker implantation procedure. We're getting more and more evidence from big studies with conduction system pacemakers, which suggests that overall it's a relatively safe way of pacing the heart. It seems to be as safe as the traditional pacemakers. But as with any procedure, there is a small risk. There are risks of complications, such as leads becoming displaced or causing injury to the heart muscle. So for installing a conduction system pacemaker, you would come in to hospital, usually just as a day case, so you can often come in, go home the same day, make a small incision, get access to the veins, and then pass a lead around to the heart, and then we need to position the lead in a very precise position so that when we stimulate the heart, it will activate the heart's natural conduction system. Once the lead's in place, we'll secure it and then connect it to the pacemaker in the same way that with a standard pacemaker, and then you be able to go home the same day.